Hi, my name is Cord Honda. I'm a dermatologist and dermatopathologist at University Hospitals Cleveland Medical Center. I'm a professor of dermatology at Case Western Reserve University School of Medicine. I think, if we can control the microbiome of the skin, that may prove to be helpful down the road, but nothing that's currently newly FDA approved for that treatment. There are topical androgen inhibitors, which are relatively new, to help with the oil production that leads to acne that can be helpful for some patients. Yeah, so again, the most important thing is to try to treat the initiating factor in acne. So really the base treatment for a lot of acne is going to be topical retinoids, whether it's topical or oral. So I'm thinking things like over-the-counter adapalene, trade name is different, topical tretinoin, topical tazarotene is another one. Those are usually what I start with initially, and I will often add benzoyl peroxide. You can use it as a wash, or you can use it as a gel or a cream. The thing you do have to be careful with benzoyl peroxide is it can bleach your clothes, so pillowcases or any clothes that the patient comes in contact with. That's why I personally like to wash, because you can wash it off and not have to worry about that quite as much. And then sometimes topical antibiotics if they have an inflammatory component of their acne, so that's more of the whiteheads. And the important thing is you want to wash, if you're going to use benzoyl peroxide in addition to the tretinoin or the topical antibiotic, you want to wait half an hour after washing your face with the benzoyl peroxide before you apply the tretinoin or the benzoyl peroxide. Usually, some of them can be a little bit irritating at first. If you keep with it, it gets better with time. The important thing is to remember it's not spot treatment. If you want to treat the whole face and not just individual pimples as they pop up, because we have a much better track record of preventing the new pimples than treating the pimples that are already there. And then it takes about 2 months to notice improvement. So don't give up on it, and encourage your patients not to give up on it if they don't see results right away, because it's really helping the new ones that are going to be coming up to prevent those that are going to really help them to improve their acne. We do have a lot of other treatments. You also want to inquire about the hormonal component in girls and women, because that may not always respond to some of these topicals. It might require either an oral antibiotic or an oral medication such as an oral contraceptive, or an oral medication called spironolactone, which can affect the male hormone that is contributing to the acne. And then for really severe cases, isotretinoin is quite effective. It does involve registering the patient. It's a little bit more involved because it has more side effects that the patient has to be counseled on, and it's regulated through a system called iPledge to make sure that more serious side effects such as birth anomalies for a girl or woman who gets pregnant, we want to really avoid that, because that is very common with that medication, but it is quite effective, but it does carry more side effects. So most patients can be treated with a scale of those products, and depending on how severe they are when they present, and we can kind of titrate things as needed. No, I think it's not as popular as it used to be before, but red light therapy, I used to have patients ask me about that a lot more maybe 5 years ago. I haven't had a lot of patients ask me about that more recently.